Today I'm going to be talking about CDC recommendations for COVID vaccination. It is November 23rd, 2024. CDC says that everyone 6 months of age or older should get a 2024 to 2025 COVID-19 vaccine. The COVID-19 vaccine helps protect you from severe illness, hospitalization, and death. It is especially important to get your 2024 2025 COVID vaccine if you are age 65 and older and are at high risk for severe COVID-19 or have never received a COVID-19 vaccine. Vaccine protection decreases over time, so it is important to get your 2024-2025 COVID vaccine. Again, everyone ages 6 months and older should get the 2024-2025 COVID-19 vaccine. This includes people who have received the COVID-19 vaccine, people who have had COVID-19, and people with long COVID. It's important to stay up to date. Getting the COVID 2024 2025 COVID-19 vaccine is important because protection from the COVID-19 vaccine decreases with time. Immunity after COVID-19 infection decreases with time, and COVID-19 vaccines are updated to give you the best protection from the currently circulating strains. Getting the COVID 2024 2025 vaccine is especially important if you never had a COVID-19 vaccine, are age 65 years and older, are at high risk for severe COVID-19, are living in a long-term facility, are pregnant, breastfeeding, trying to get pregnant, or might have become pregnant in the future. Keep in mind that getting a COVID-19 vaccine is safer, more reliable to build protection than getting sick with COVID. The CDC says that if you are 12 to 64 years old, you are up to date when you have received one dose of the 2024-2025 Moderna COVID-19 vaccine or one dose of the 2024-2025 Pfizer-BioNTech COVID vaccine or one dose of the 2024-2025 Novavax vaccine unless you are receiving a COVID-19 vaccine for the very first time. If you have never received any COVID-19 vaccine and get Novavax, you need 2 doses of the 2024-2025 Novavax COVID vaccine to be up to date. People 65 years old and older, you are up to date when you have received 2 doses of any 2024-2025 COVID-19 vaccine 6 months apart. While it is recommended to get 2024-2025 COVID vaccine doses 6 months apart, the minimum time is 2 months apart, which allows flexibility to get the second dose prior to typical COVID-19 surges, travel, life events, and healthcare visits. Exceptions are if you are receiving a COVID-19 vaccine for the first time and getting Novavax, you need 2 doses of the 2024-2025 Novavax COVID-19 vaccine 3 to 8 weeks apart, and a third dose of any COVID-19 vaccine 6 months later. If you are received one dose of Novavax vaccine before the 2024-2025 vaccine, you need a second dose of the vaccine Novavax vaccine and a third dose of any COVID-19 vaccine 6 months later.